Pancreatic cancer, minimally invasive versus open surgery. Results from the multinational diploma research suggest that patients with resectable early-stage pancreatic cancer can safely undergo minimally invasive distal pancreatectomy, MIDP, as an alternative to conventional open surgery. Only around 12% of people with pancreatic cancer receive a diagnosis at a stage where surgical resection is still an option. When minimally invasive pancreatectomy, namely the distal method, was first developed, it was only applied to benign tumors and potentially cancerous lesions. The main reason for this delay was doubts about the oncological effectiveness of MIDP in terms of its capacity to achieve radical excision and an appropriate lymph node yield. It took another 10 years before it was considered in cases of proven malignancies. The findings of randomized studies in other cancer types, such hysterectomy for cervical cancer, also led to some concerns being raised about minimally invasive surgery for cancer. Compared to open surgery, some studies found a worse rate of survival following minimally invasive surgery. The use of minimally invasive procedures for pancreatic cancer has recently gained popularity in many surgical forums, and the International Diploma Study team set out to investigate the method in a Phase 3 non-inferiority trial. The study team's findings are now being closely scrutinized for safety and outcome. The researchers concentrated on individuals who had a confirmed or strong suspicion of having pancreatic ductal adenocarcinoma in the pancreatic body or tail, which was a reason for elective distal pancreatectomy plus splenectomy. Between May 2018 and May 2021, patients were enrolled from 35 sites across 12 nations, and they were then randomly randomized to get either a MIDP or an open distal pancreatectomy. By covering the abdominal wall, the surgical procedure was concealed from the patients, nurses, and pathologists. Adjuvant or neoadjuvant chemotherapy was not administered to any of the patients. Following the procedure, the patients underwent a CT scan at 12 months and were checked at 2 weeks, 1, 3, 6, and 12 months. Each visit included a variety of evaluations, including checks on the quality of life. 261 people were included out of 1146 patients who were initially screened. A small number of patients withdrew. The intention to treat analysis included 127 patients who received open surgery and 131 patients who underwent MIDP. The follow-up analysis included, respectively, 129 and 125 of those. In the study, almost 260 individuals were randomized to receive minimally invasive laparoscopic, robot-assisted or open surgery. Between the groups, the rates of total tumor eradication were comparable. Additionally, at 3 years, the rates of overall and disease-free survival were very similar. It is hoped that this study will help reassure surgeons and can help patients by giving them the information they need to have a conversation with their doctor about how they want to be treated. The study shows for the first time that minimally invasive distal pancreatectomy is as good as open surgery. This confirmatory study demonstrates that minimally invasive surgical methods are a secure and reliable treatment choice for resectable pancreatic cancer, and they may also offer advantages, including a quicker recovery and a lower risk of infection without raising the chance of developing cancer. It also shown that the rate of major adverse events, such as bleeding or organ damage, was comparable between the two treatments, with minimally invasive surgery accounting for 18% of cases compared to open surgery's 22%. The study found no benefit for the minimally invasive technique in terms of shorter hospital stays or greater functional recovery, but this could be because postoperative practices varied among the participating sites. The study also appears to demonstrate that high-volume facilities with surgeons performing more than at least 50 pancreatic resections a year provide the greatest outcomes. This is believed to be due to the minimally invasive procedure being quite complex and difficult, more so than open surgery, and it needs highly specialized centers too. The trial's findings will provide surgeons and patients confidence that, in the hands of skilled practitioners, minimally invasive surgery is not subpar to open surgery. In order to assess whether excision of the spleen is required, the researchers will continue to monitor the patients for another 3 to 5 years, while also analyzing the lymph nodes that were removed. The study's findings will be presented at the American Society of Clinical Oncology meeting, ASCO, 2023 on June 5th. Thank you for watching this video from OncoloMed. Please like and subscribe.